My name is Dr Mahmoud Bakr. I'm a lecturer in general dental practice at the School of Dentistry and Oral Health, Griffith University, and I'm one of the examiners in the Australian Dental Council practical examination. A very interesting background. I did like a little bit of training as an Air Force pilot within the Egyptian Army, and then I decided that that was no good for me. Didn't pursue that, and I pursued dentistry. So I graduated from Cairo University in 2004, and I got offered an academic position where I did my master's degree, and I completed my master's degree in 2010, and then moved to Australia and started my ADC examination process as a candidate. So I've always wanted to be somewhere within the health industry. Most of my family members are either scientists or medical practitioners, every possible specialty, and I'm the only dentist in the family. I wanted to be a dentist in Australia. I had to follow the procedure, so I asked around, how can you get your certificates or your qualifications recognized, and the answer was the Australian Dental Council examination process. So I had to do that while working nearly full-time in other jobs. So it took me about 18 months to go throughout the whole process, from collecting the documents and the assessment, the English test, the written exam and the practical exam, which used to be actually 6 days at the time when I did that in 2010. After that, I started my very first and current job in Australia, which is at Griffith University. So I started teaching there, which was a continuation of what I did in Cairo University, teaching all the basic science, preclinical and oral biology courses, as well as head and neck anatomy. I'm also one of the clinical supervisors, and I maintain an intramural private practice within the university to keep my hand skills going and recency of practice. I've also completed 2 degrees in higher education, a graduate certificate in higher education, and also a fellowship with the Higher Education Academy. I also submitted my PhD, so I don't think I'll be doing any other degrees anytime. The fellowship is something that you apply for based on your expertise, based on certain workshops or studies that you do, and based on your achievements in the field of higher education. So you have to be doing something really innovative or something promoting excellence in learning and teaching. In my case, the highlight of my academic educational career was the start of using virtual reality in development of psychomotor skills for dental students. So they wear 3D glasses and they use haptic simulators to develop their skills. I also use augmented reality in teaching head and neck anatomy. So these were the 2 highlights or the innovative approaches that I used in higher education. It's also based on using or developing online resources that are actually shared across different universities in Australia, and I'll actually start sharing them across universities all over the world that are related to dental anatomy and head and neck anatomy. So you have to do something really outside the box and provide evidence about that, which was in my case the students' feedback, that they really enjoyed using those innovative applications, and it also helped them achieve better learning outcomes. Also, I use evidence-based approach in my learning and teaching activities. So all this evidence I collected and published in about 7 or 8 journal articles in prestigious educational journals, and I have 2 book chapters written about those educational approaches as well. In the beginning, it was like a dream. So sitting on one side of the table, and then sitting on the other side of the table. And it does actually help me because I understand the emotional part behind this experience, because remember, I had to go through the same examination process, which was a bit longer at that time, and I had other things going in the background of my life, recent immigrant, working like different jobs in order to sustain like a living while going through the exam. So I understand the emotional part behind it, and I also understand the support that the candidates would need throughout this examination process. I also understand like the commitment, the dedication, and the amount of time that the candidates will have to put in preparation for this examination. Backed up with my educational expertise now, I think that works very well. Time management, commitment, and this examination is to ensure that candidates are safe to work and practice in Australia. So sometimes there is more than one correct answer to a question. So if the candidate is unsure, you just close your eyes and think, if I was in a clinical practical setting, if I was in my own private practice, or if I was in my normal daily job as a dentist, what would I do? And most likely that would be the correct answer.